My interesting question, like I always ask like super empirical people, is and I think it's a real differentiator because this really like attacks the heart of um the difference between these two types of truth in a really like kind of practical way. And that is let's take Nurofen that was targeted for back pain or period pain relief. And it was marketed saying, Nurofen, it's a form of ibuprofen, and this is specifically good for back pain.
Yeah,
And it's twice the price of regular Nurofen, but this is the one that's going to sort you out. And it got banned in the UK because ostensibly it was just regular old ibuprofen. However, study after study showed that it was way better at relieving back pain because of people's expectation that it was going to relieve the back pain. So in a sense, it's not a full placebo because it is actually an analgesic in there, but like it's some kind of psychological operation going on there. And they banned it in the UK. They said, well, look, from a scientific perspective, from an empirical perspective, this is just the exact same compound, ignoring the fact that both the marketing of that drug and the price of that drug, the fact that it was more expensive, were both two things that were alleviating pain because you're like, well, this is more expensive. Um, and so my question to these types of people is like, well, what do we do with that, right? Like, what do you, why, like, should that be illegal? Like, should it be illegal to say this is better for pain relief in a specific way when it actually is, but not for any like practical reason, but because for a purely psychological reason. And I think that is the kind of question Richard Dawkins would be like, well, of course it should be illegal because there is no, um, there's no biochemical reason why that would change things. But then Jordan Peterson would be like, well, of course it should be illegal. Like, the effects, look at the effects and look at the whole psychological stack that's like kind of back propagating down to the perception of the back pain or the period pain or whatever. Um, so that for me is, I think, how like I always ask that question to people who are very much kind of on the empirical side of things. Um, and ultimately, though, I think, the same problem you have there, I think it's the same problem Peterson has, to be honest, is where does that stop? Like because it's less like testable, it's less like obviously empirical. Like where does it, where does it get too much in a way? And so yeah, I think yeah, I mean, curious, what are your thoughts there on that? Like, would you make that illegal?
well, yeah, I think that's the right question. Is like when does it get too much? For example, like like crystals. Like some people find that crystals are healing, and it
Right.
probably does have some positive effect, if you're bought into that. And but should it be illegal for a doctor to prescribe you crystals?
Yeah, well, people to sell you crystals to cure your cancer, which they probably should be having radiotherapy. Um, so yeah, I think there has to be I mean, this is like kind of again ties back to empirical, but there has to be a deeper model of medicine, I think, which factors in the perceptual brain, and this is completely off the topic, I guess, now to an extent. But you cannot have the deepest possible theory of medicine if your theory of medicine does not include the fact that the brain um, can again like back propagate its own predictions about any given situation down onto the body. So, for example, like we know for a fact, like stress and like your psychological state massively impacts your immune system. Um, we know chronic pain, a lot of it is eventually nothing, there's no like negative stimulus. It's just like the expectation that you would be in pain